Shabab, the role of Shabab, the role of anterior cruciate ligament is it will not allow tibia to come anteriorly. But if injury to the anterior cruciate ligament, what happens? Tibia will come excessively anteriorly. Okay, that is the reason behind the test. Okay, yeah, maybe lie on this. Okay, sorry, you can see. Get that side. Yeah, lie down, lie down, lie down. Yes, good, thank you. So keep only 20 to 30 degree flexion, right? Then hold thumb here like this, both the thumb, the fingers the behind. Then when you do fingers behind, just stabilize or hold up the hamstring tendon. Because when hamstring tendon is tight, what happens? Hamstring tendon will not allow tibia to come anterior. Because hamstring tendon attached to the tibia, so it will not allow to translate anterior. So compress the hamstring tendon upward, then do anterior translation. See, compare both sides, right and left. If one side is excessive tibia is coming forward, that indicates, right, anterior cruciate ligament injury. Next one, after Lechman's, right, anterior drawer test, keep 80 to 90 degree knee flexion. That time also hold with the index finger up, press up, then do anterior translation. So this also there will be excessive anterior translation. Then last one, pivot shift test, right? How to do? That is, right, knee is slightly flexed, 20 to 30 degree flexion, then keep valgus stress, give valgus stress, then rotate knee internally, or maybe like this. 1 minute, relax, 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 relax. So hold here, give valgus stress, then rotate internally, then do knee flexion. Right? 1 minute.
Okay. أكمل mobilization حق جاي mobilization حق جاي.
So like this, right? Hold here, keep valgus stress, right? Then internally rotate, then do flexion, right? So that time also there will be a pain or there will be some instability that indicates anterior cruciate ligament injury. Okay. So this is only anterior cruciate ligament injury. The remaining exercises are safe. Strengthening and stretching exercises are safe. Which already is there for which one? Menisci and hamstring. So after then coming to regional conditions. Regional conditions, first one is rotator cuff. Rotator cuff special test, knee impingement. Knee impingement, how? Anybody? Ortho, studying ortho, knee impingement. Sit down, Mafi, sit down. Okay, so keep like this, internally rotated shoulder, then do, right, abduction. Sorry, flexion, full flexion. That time, no, there will be a pain. First do shoulder, right, internally rotation. After internal rotation, do the flexion. This time, there will be a pain. So impingement, which one? The head will go and impinge with the coracoacromial arch. By that, there is a inflammation already exists in the rotator cuff muscles. So with that, there is a pain or limitation of movement. Okay, number one. Number two, Hawkins-Kennedy impingement test. 90 degree abduction and flexion, right? Or like this, sorry. 90 degree flexion, then do elbow flexion, then do internal rotation. This time, if there is a pain that indicates rotator cuff injury, then supraspinal test or MT can test, or other name is job test. Keeping like this, right? 35 degree angulation, keep like this. Okay, now do this movement. Yes, when this movement doing, we can give resistance also, do up. If resistance, while giving resistance, at that time, if there is a pain, that indicate rotator cuff injury. So 3 tests are there, rotator cuff injury. So this also will be asked for the exam. Then going into Bicipital tendonitis.
Yes.
Speed test, just straight arm, supine position. No, sorry. The forearm in supine position. Shoulder from 0 degree to just flexion. Resisted flexion. Therapist should give resistance. Up, 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 up. At the time pain will be there. So that indicates bicipital tendonitis. That is number 1. Number 2, Jorgensen test. Jorgensen test, patient should keep like this. Shoulder neutral, elbow 90 degree flexion, both the elbow. Now the patient, you have to do this and this both. Supination and lateral rotation. 2 you have to do, but not only both together. Okay? Yeah, like this together. So I will resist you. Okay? Yeah. Do. No, don't bend. Don't bend. Right? Like this. Okay? Yeah. Do. So when we do this, right, therapist resisting, that time also pain will be there in the bicipital groove. That indicate bicipital tendonitis. Then moving into next. Tennis elbow, Cosen test.
كان أحسن.
Right? So Cosen test will be like this. Do wrist flexion, right? Wrist flexion, then pronation, then extension. Sorry, this one. Cosen test simply like this only, right? So pronation, wrist into the flexed position. At that time, right? One hand should palpate the lateral epicondyle, right? Another hand should resist the extension. Yeah, up, 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 up. So that time no pain will be there here. This is Cosen test. Mills test, right? Come please stand. Sitting position is better, but here. So wrist flexion, okay, pronation and knee extension. Sorry, elbow extension. This will be painful. This is called Mills test. See, wrist flexion, finger flexion, wrist flexion, then slightly ulnar deviation, then pronation, finally elbow extension. This is called Mills test. Again, pain in the lateral epicondyle. Finally, tennis elbow test. Sit down. So we are doing middle finger extension. Doing middle finger extension because brevis is inserted here. Up, up, up. At the time, therapist can palpate here, so there will be a pain. Okay, this is tennis elbow. The last one, golfer's elbow. Golfer's elbow test is wrist flexion, resisted wrist flexion. Keep into the extended position. Then with this, palpate the medial epicondyle and do wrist flexion. That time no pain will be there in the medial epicondyle. That is medial epicondyle test. Okay, that's all finished practical.
Okay, thank you, Doctor.